It is a startling statistic that many of us ignore. Heart disease is the #1 killer among women, but a little awareness can save your life. And here to explain is Donna Schultz, a heart attack survivor, along with Dr. G from Florida Hospital Carrollwood. Good morning. So happy you're here to share your story. And again, it's something that us women, we were talking about, we tend to ignore our health, right? Talk about your story real quick before we kind of dive into maybe some of these signs and symptoms that women need to be aware of. But I'd imagine you didn't think you'd be sitting here.
I did not. I did not. I'm a very lucky survivor. I'm a nurse at Florida Carrollwood. I had a heart attack, and very wonderful hospital with great cardiologists like Dr. G, who's sitting right beside of me.
But you really didn't have much family history?
I did not really have hardly any risk factors. I had just lost 20 pounds, started a workout program.
You were doing what you should do.
I was doing what I should do. I had woke up from a couple of nights of 12-hour shifts, so I was extremely tired. One of my biggest symptoms was fatigue. You couldn't peel me off the couch. And my husband's there, you know, I'm having pain, not specifically chest pain. I was having very atypical symptoms, which is typical of women. We don't always have the classic symptoms. And I had pain, and did I have chest pain? Yes, I did. But I had pain everywhere. I had shoulder pain, back pain. You know, I was doing exercises that would have caused that. So I just kind of, you know, after talking to my husband, I passed it off as, oh, it's just from working out. I'm the last person I thought would ever have a heart attack.
So you eventually go in, we figure out what happens. Is this pretty, doctor? I mean, when you hear this, she's doing everything right. She's feeling, I mean, what say you, doctor, when a patient like this comes in?
So, you know, what Donna experienced is not the first time. You know, we see this a lot in women. They tend to present with different symptoms than men do and tend to push it off a lot more than men do as well. You know, what she had, the fatigue, is a huge symptom. You know, what we try to explain to our patients is that try not to ignore what you're feeling. You know, you may have started that workout, you may be doing the right things, and all of us, even if we don't think we have risk factors, can still have heart disease.
So real quickly, fatigue, she mentioned fatigue. That's a big warning sign for women. What are some other ones real quickly?
I've seen a lot of patients with nausea, this unbeknown, you know, abdominal pain that just doesn't go away. Sometimes I've seen even atypical symptoms as hiccups that just don't seem to get better despite what you do. And all of a sudden they have a heart attack, you treat the heart attack, and the hiccups just disappear.
Wow.
Yeah.
We have a minute left. I'm assuming the take home is go see your doctor if anything seems out of the ordinary. But there's a lot of events where we can talk about this, where we can encourage our lady friends, right, to make sure that they put their health a priority. Is that kind of the message behind this month? Absolutely.
And this month, especially given it's Heart Health Month, we have a couple of events that we wanted to let the public know. You know, on Friday, it's Wear Red Day. You know, it's Heart Health Month. Go out there and, you know, show everyone that you believe in heart health and that you want people to get better. And Florida Hospital Carrollwood, especially on February 23rd, we have 15 minutes for your heart. It's a free health clinic that you'll have a chance to see a provider, including myself. You'll get blood work done. You'll have all of your labs and all of your history reviewed and have some insight as to what you need to do next to stay healthy.
And it's so interesting as we kind of wrap up. It's you know, heart rate for women, right? But I think men need to know, family members need to know, and all to encourage each other, again, to put your health a priority and making sure you're doing that.
And just know if it doesn't feel right, it doesn't feel right, that's a sign. So go to the hospital and get taken care of, because I had the Widowmaker and I was lucky to be here. So
well, we're blessed to have you here, and we're very thankful for all the events, and hopefully we can save somebody's life.
Thank you for having us.
Saying, you know what, I need to go to the doctor, get this checked out.
That's right.
That's right.
Thank you so much again. We'll put all the events on our website.
Appreciate it. Thank you.